Recently, the Agriculture Fairness Alliance hosted a panel of experts who made the case for prioritizing fiber-rich foods in federal farm policy. Kristy Anderson, Senior Government Relations Advisor at American Heart Association, gave opening remarks. Here she is.
And hello, everyone. Thank you for joining us today. As Addison mentioned, we've got an esteemed panel that will make the case for prioritizing fiber-rich foods in farm policy. As Addison said, I'm Kristy Anderson. I'm our Senior Government Relations Advisor at the American Heart Association and manage our federal advocacy work for nutrition policy. So first, why focus on fiber-rich foods? While it is important to eat a variety of foods and think about diet quality beyond just fiber-rich foods are a great source of providing nutrients we need, such as the suite of B vitamins, iron, magnesium, and selenium. Fiber-rich foods are also found in foods more Americans need in their diet, such as fruits, vegetables, and whole grains, and tend to be lower in things we need to eat less of, such as saturated fats, added sugars, and sodium. Dietary fiber has been shown to help improve cholesterol, which in turn lowers the risk of heart disease, our nation's #1 killer and costliest preventable chronic disease, stroke, obesity, and type 2 diabetes, and, with New Year's coming up, can also help with weight loss. However, our food system is contributing to a chronic disease crisis and a crisis in which proper nutrition and diet quality play a large role in mitigating and preventing these diseases. Now, in the materials you received, one of the materials is a GAO report. So if you haven't read it, I would encourage you to read that recently released report, which analyzes the nutrition-related chronic disease crisis and the federal government's response. If you all have like 8 hours, we could go through the report, but that's not why we're here today. We're here to hear from this panel of esteemed experts. Say that fast 3 times. One big takeaway from the report is that government spending, including Medicare and Medicaid, to treat cardiovascular disease, cancer, and diabetes accounts for 54% of the $383.6 billion in healthcare costs to treat these specific conditions. But beyond just federal government spending, when looking at the aggregate of all levels of government costs and private sector costs, cardiovascular disease alone costs this country $363.4 billion annually in both direct, i.e. medical, and indirect, i.e. lost productivity costs. So when talking about nutrition policy, I sometimes get the pushback that diet is an individual choice. And yes, the foods we eat should be an individual choice, but for too many, the choice to eat a healthy diet and fiber-rich foods isn't even an option. If the chronic disease crisis and the COVID pandemic has taught us anything, it is that we need to be bold in changing food and nutrition policy to support healthy eating, with a particular focus on under-resourced communities and BIPOC communities. And we really have a unique opportunity in this upcoming Farm Bill to make these changes needed to our food system to ensure equitable access to healthy foods, i.e. not just food security, but nutrition security as well. Or as I like to say, not calories for the sake of calories, but nutritious calories that are going to help people thrive. While most people think Title IV, the nutrition title in the Farm Bill, is a place to address diet quality, and it is to an extent, policy changes need to extend beyond the nutrition title. If everyone in this country overnight suddenly adopted and had the means to access a diet aligned with the dietary guidelines for Americans, there would not be enough fiber-rich foods, such as fruits, vegetables, and whole grains. To better support Title IV programs and other nutrition programs beyond the Farm Bill and healthy eating broadly, we need to update and modernize the other Farm Bill titles and policies within to address production of healthy foods with a focus on these fiber-rich foods. Yeah, thanks, Addison. And that's a great question. And sorry, I get the afternoon sun, so I'm blinded in light right now.
It's good when you're working during the day to stay awake in the winter. I can
Right.
understand
Exactly right. Putting aside the supply chain issues we're facing because of COVID, which is a whole other, variable in and of itself. I think it's important as we explore getting more dietary fiber-rich foods into the American diet and changing the agriculture system that we look at how we increase production at home for a variety of reasons. One, I think it goes toward supporting that local farmer, supporting the local economy. We also know too that when you support local economies, you're as you look at climate change and how that's affecting agriculture and nutritional value of the foods we eat, the more we can keep it local, the better our air quality is going to be. So it's overall better for our environment. It provides our rural communities and our agriculture system and our farmers more resiliency. I know Laura always likes to talk about it's also a national security issue to make sure that we have those healthy fiber-rich foods grown at home so they're available, right? You never know what's going to happen at the international stage. And then the last point I'll make is there are programs within the federal government, such as school meals, that have a Buy American requirement. So if we want our children to eat more fruits and vegetables, more fiber-rich foods, which, in the past decade, there's been tremendous changes and they're eating so much better, but, we can still improve upon those meals. They have to be able to buy them from American farmers.
And I saw an interesting question that came through the Q&A, and it goes back to a conversation we were having earlier in between the federal and the local. In a system that supports locally grown foods and feeding the community, how will that change the responsibility of local, state governments versus the federal government in terms of policy oversight and implementation of increasing a fiber-based diet?
Yeah, again, another great question. I'm going to take the easy way out at first and say it depends. I mean, it really just depends on what policy, what program we're talking about, right? Because we live in a very complex governmental feudalistic system, right? And so it's about threading that needle that ensures that state and local communities are serving the communities the best way, their communities the best way they can, but also ensuring that the federal government still has oversight. I mean, the reason why we have things like, food safety inspections is because somebody somewhere wasn't doing it right? And people got sick. So that's why it's done on a national level to make sure that every American has the same opportunity to eat safe food. Now, is it perfect? And that's a whole nother question, probably a whole nother discussion. No, but there are places that weren't doing it and had no interest to do that. I just use as an example. But in addition, the federal government has an awesome power, an awesome fiscal responsibility to help encourage looking at the national level and wanting to get more fiber-rich diets in the mouths and the bellies, if you will, of Americans, to use that power, to use that legislative process, to use that regulatory process, to use that taxpayer dollar to guide states and to guide localities into meeting those needs.